Dr. Toll mentioned, so cuneiforms have some depression as well, or mobility. So if finding that I'm going to hold the first metatarsal again, I can literally mob the cuneiforms. And the same concept, if you have a stiff foot, supinated foot, we can mobilize the cuneiforms as well. And I don't think we have to worry about the concave-convex rule when we're thinking the three cuneiforms moving together. Just understand that you guys stabilize the metatarsal, and you can do that all kind of one group, in a sense, really. So I'm going to stabilize the metatarsal this way and then mobilize the cuneiforms kind of in a downward direction. All right? But I want to mobilize the metatarsals now. I'm going to stabilize the cuneiforms. And we're going to move the distal, which is the concave, correct? So we'll use concave-convex rule now. So I have a limited plantar flexion, limited flexion of the foot. Which way do I mobilize the first metatarsal? In a posterior direction. Awesome. So I'm going to stabilize the cuneiforms. I'm taking the first metatarsal, and I'm going in a downward direction. So I'm moving a concave on the convex. Right? Does that make sense in theory? You guys are good? Okay.
Say it again and just do it again.
We're moving a concave on the convex, so same direction to improve flexion or plantar flexion. Going to stabilize cuneiforms, move the first metatarsal in a downward direction. If I was limiting extension or dorsiflexion possibly, same concept. I'm going to stabilize the cuneiforms. I'm now moving the first metatarsal in an upward or anterior to posterior. Well, upward direction or dorsal direction.
No, anterior direction.
Oh, yeah, into the upward direction.
To be anterior. Come home. Come home.
Okay. And why don't we just go? And I think of all the other metatarsal, the MTP joint is probably one to think about the most. The first